recording.
So good afternoon and welcome to Friday. I guess it's Friday. This is our day number 30 of Business as Usual. I'm Audrey Russo, President and CEO of the Pittsburgh Technology Council, and I'm joined today by Jonathan Kirsting, who's Vice President of Visibility at the Tech Council and also my co-host on many of our media outlets. So a few things about today's call. It wouldn't be possible. You can see by Jonathan's background, our friends at Huntington Bank, they actually have been, they really stepped up to help us make sure that we can do this each and every day. They are the largest SBA lenders in Southwestern Pennsylvania and very active civically in our community. I also want to thank AT&T. They too have been actively engaged in making sure that people get access to what they need during this COVID-19 epidemic, and they're also very active in terms of making sure people get the food that they need by participating in 412 Food Rescue, as well as Allies for Children and the Greater Pittsburgh Food Bank. So today, I'm pretty thrilled that we have a guest. We have Adam Marles, and he is the president of an association that he's going to tell us a little bit about, but part of this conversation today is really around the COVID-19, what's happening with our aging population, and noting that more than 75% of all COVID-related deaths in Allegheny County and 90% in Beaver County have occurred in nursing homes to date. So it's clear that we need even more advocates locally and nationally for the vulnerable populations. And I can't say more emphatically that if we solve this problem, we can eliminate the vast majority of fatalities here and across the Commonwealth and probably around the nation. So I hope you will have some questions for Adam and appreciate that he's taken the time with us. And in 1 minute, I will pass the baton in starting a question and answer with him. So a little bit, we mute, if you've not been on the calls before, we mute your microphones. And we do that because there's a lot of noise in the background. I have dogs, many of you have kids. There's lots of noise and we want to make sure that we can hear our guests. But we also want the call to be highly interactive with the opportunity to ask Adam some questions. And if you can see at the bottom of your screen, there's a chat room. And Jonathan will actually monitor those questions and make sure that you can ask the questions of Adam. And lastly, I just want to remind everyone that this isn't an opportunity for you to really sell your wares or advertising. It's really just about community and diving deep on the topic at hand. So with that, I'm introducing Adam Marles, President and CEO of an organization called LeadingAge PA. And so good afternoon, Adam. Thank you so much for taking the time with us. Can you just start out and just tell everyone what your organization is, what your mission is, and a little bit about some of the issues that you're tackling?
Sure. Thank you so much for having me. I'm happy to be here. LeadingAge PA is a statewide advocacy organization that represents nonprofit providers of aging services across the continuum. So our mission is advancing the evolving continuum of aging services, and that includes nursing facilities, personal care homes, assisted living facilities, retirement communities, senior affordable housing organizations, home care and home health providers, adult daycares, and life providers. And what we do is we take their interests to Harrisburg and try to make sure that, that they're well represented, while also making sure that they have the resources to maintain the highest standards of quality. And if you look at the people or the organizations that are members of ours, they represent really the best providers statewide because they focus entirely on making sure that older adults are cared for above all else.
Okay, so COVID has taken a particularly high toll, as I mentioned earlier, on people that are over 65 in Pennsylvania. In Allegheny County, the problem has been pronounced as it relates to nursing homes and some of the members that you represent as well. So 75% of the COVID deaths having occurred in long-term care facilities, and I think as high as 89% in Beaver County, and I think about 73% in Westmoreland. So the affinity kind of counties. Can you tell us how we compare to the rest of the Commonwealth, and then share some ideas that you're suggesting both to your constituents and to policymakers to help protect this particularly vulnerable population?
Sure. I think the place to start is just a reminder that this is a virus that is really tailor-made to attack older adults. When you look at the people who are being most affected, it's people who are older, it's people who have underlying conditions, and it's people who have weakened immune systems. And by definition, the people who live in nursing facilities, who live in personal care and assisted living facilities, fit all of those categories. And so they are most vulnerable. And then you put them in a congregate setting where spread can occur more quickly than in other settings. And sure, they are going to be the ones who are affected most. As it pertains to Allegheny County and Beaver County and your local counties relative to the state, you're a little bit higher than the state average, which is about 65% of all deaths related to COVID-19 occurring in long-term care communities. Some of that is there are a lot of long-term care communities in the Allegheny County and surrounding areas. And you've got, at least in one case, obviously with Brighton, a situation where you had a significant number of deaths. But largely, I think part of what we need to share is the success story of what long-term care communities have been able to do to keep people safe. Across the state, there are approximately 2,000 long-term care communities, whether it's nursing facilities, personal care homes, or assisted living facilities. And less than a quarter of them have a confirmed case. So we obviously want to focus a ton of attention on making sure that those facilities and communities that have cases are taken care of, they have what they need, but we also need to celebrate the work that's been done by the other providers that have kept this very vulnerable population safe. The things that we've been trying to advocate for include, as a number one issue, a lack of personal protective equipment. We cannot adequately keep people safe if we can't protect both the people who are caring for them and the residents themselves. We've heard stories of people wearing ponchos or garbage bags instead of gowns. I'm sure you've heard about communities asking for cloth masks, and I assure you, any healthcare facility will not request cloth masks if they can get what they really need. So we have had some support from the Department of Health and PEMA. They've pushed out some packs of PPE over time. It's just not enough. So we appreciate the efforts that have been made, but we're not getting what we need. So that's number one, and that's going to continue for some time. Another thing that's an absolute high priority is testing. We need to make sure that we are providing more testing in every one of these communities. This is a virus that we know can be spread by pre-symptomatic or asymptomatic people. And if we can't test people to know who has it and who doesn't, it makes it much, much harder to prevent spread and prevent infection. So we need to make sure that there's adequate testing and then regular testing, especially now in an hour and a half, 2 hours, the governor is going to be talking about reopening parts of the Commonwealth. Right. And as that occurs, the need for testing becomes even more apparent. So that's two big things. Another one is fit testing. Training for staff members, training for residents on how to use N95 masks, because it's not as simple as just throwing it on your face like you would a mask in your wood shop. It's something that requires a snug fit to work adequately, and so we need to make sure that that testing is provided. And then finally, in addition to a thoughtful reopening, making sure that we're not taking this too fast, it's funding. We definitely need more money.
So how have we done in Pennsylvania compared to other states or, the Commonwealth? How have we done? I mean, there's been a lot of focus on economic development and incentives and, lots of focus on the prosperity and all the things that we care about at the Tech Council, but how have we really done?
From a funding perspective, it's been really difficult. There has been some federal funding that's been made available for long-term care providers. There are strings attached to it and some concern that some of that, or maybe all of it, may need to be paid back on the back end, which creates a certain uncertainty. But with respect to state funding, so far the answer is $0. There have been no dollars provided by the state to help long-term care at all. We put a request into the governor 6 weeks ago asking for $290 million, which was our calculation of what over the course of 120 days the additional costs related to COVID-19 would cost for providers statewide. We've heard no answer to that request at all in 6 weeks, despite repeated requests for that to be given attention. I can say this week in the Senate, there was talk of a bill that would provide $200 million of funding for long-term care. We need to see the details as they get worked out. We need to understand how that money may be distributed. So we're hopeful that we may see some of that funding be delivered over time. But as I said, to date, there has been nothing.
From the state and from our Commonwealth, has there been anything from
No.
the Commonwealth? Nothing. How did
No
we
dollars.
How did we all miss this? We have Allegheny County, has a very, over 65, over 70. We're one of the highest concentrations of people who like to stay here, like to live here, and like to live their final days in our region. How did we miss this? How did we, just totally miss sight of this, despite the fact that we're at the arc, supposedly, in terms of a downward slope, because the hospitals are underutilized in terms of the COVID cases? How did we
I wish I had a good answer to the question. We've been raising it with the loudest voice that we can for weeks. And I think part of it, it would be helpful to provide a little context. So long-term care, more than 2/3 of the people who live in Pennsylvania, who live in nursing facilities, are reliant on the Pennsylvania Medicaid program.
Okay.
That program in Pennsylvania hasn't seen a rate increase since 2014. So our providers have been taking a loss on every person they care for every single day in nursing facilities for years. We had a study done last year that showed that on average, nonprofit nursing homes lose about $80 per person per day, providing care to those people on the medical assistance program. So we've been fighting for dollars for a long time. And I think as the COVID-19 crisis emerged, a lot of attention was placed on hospitals, and rightfully so. There was major concern about surge and how that capacity was going to be dealt with. Part of what we anticipated from the very beginning was if a surge occurred, one of the locations that the surge was going to need to utilize to manage it would be long-term care. Thankfully, the surge hasn't happened the way we thought, but long-term care has been impacted, as we've been talking about, very significantly, and not just from deaths, from cases. We've seen many recoveries, which is fantastic, but this is a problem that's going to continue in long-term care facilities because of the vulnerable population for some time, until we get the PPE, until we get the testing.
Wow. Yeah, I mean, I'm overwhelmed in terms of just listening to that. Jonathan, are there any questions out there?
Not yet, but I have one, and I'm just curious. I mean, we see these numbers and it's just staggering, and they're plain as day to see. And I'm thinking, like, our officials should be seeing these numbers and then realizing that so much impact could be happening if resources are directed immediately towards these long-term care facilities. I'm just like astounded that nothing is being done, because if you look at those numbers, it says this is where it's happening, and it's nothing going there. I mean, how can we help you scream and shout this to our elected officials and other folks that are a part of this to get the awareness going?
Honestly, I think that what you just said is perfect. Scream and shout it to your elected officials. Use social media, call or send a letter, if you still do that, to the people who are in the state legislature, to the governor's office, to the Department of Health. Let them know that you think this is important. Nothing moves government like hearing from the people that they represent. Absolutely. And I think part of what we're trying to overcome all the time is older adults generally tend to occupy kind of a secondary tier of society, a forgotten group in many cases. And the people who live in long-term care in particular, and those who are in need of 24-hour daycare, don't have the ability to speak for themselves.
That's a really good point.
They can't leave their long-term care community for fear of not surviving in some cases, honestly. And so we need to raise our voices on their behalf. They are the most vulnerable people in our society. They need our help, and they've earned it, right? They built the civilization that we enjoy right now. So let's step up and do what we can to help them.
It's truly a forgotten group of people and an important part of our population, and it blows my mind. We do have a question here from the chat, and asking who monitors the accuracy of the stats for cases, recoveries, and deaths coming from nursing homes?
The Department of Health has, every time there is a positive case, it's reported to the Department of Health, and we're reporting to the Department of Health daily. There are some new requirements. We're also going to be reporting to CDC moving forward on a regular basis, which is a new requirement. And actually, one of the things that we're dealing with, and one of the reasons funding is so important, is right now, on a daily or weekly basis, our members are reporting to no less than 6 different databases. And every time that a report needs to be run, that's human work, right? Someone's got to be doing that work. And in some of our smaller facilities, the person who's doing the reporting is the same person who should be on the floor helping somebody.
Right.
We are seeing in our communities people who work in an office being enlisted to serve food, to do cleaning, or to do whatever needs to be done because the needs are so great. So that's definitely something we've been working on, trying to figure out a way to get more efficient in the way that we're reporting these stats. But I also want to go back to the funding for a second and just explain why we need additional funding. Part of it is anybody who's working in a COVID positive unit or neighborhood in a nursing facility or other setting, almost statewide, is getting some sort of additional pay, hazard pay, warrior pay, whatever you want to call it. So there's additional costs there. But we need more PPE, so we're buying it from wherever we can get it. And those costs have gone up through demand extraordinarily. So there are supply chain issues, which are a real problem in getting these materials. But when we can get them, here's an example. The N95 masks that we've heard so much about, before all this started, were less than $1. Now we're seeing prices between $5 and $7 per mask. We were talking with a potential supplier for gowns for our members earlier this week. The cost of gowns in some cases seems to be going up by double because manufacturing is being brought back on shore, and raw materials are more expensive, but there are also some opportunist folks out there. And then even things like delivery of food. So before all this started, before the restrictions started on what people can do and social distancing and all those things that are keeping people safer, we would have communal dining. Now, to keep people safe, meals need to be prepared separately, packaged separately, and delivered to people individually. So that raises costs. So all of these things compound into significant demands. And as I said before, nursing facilities in particular were previously underfunded. And what we're going to see as a result of this, if we don't start getting some help soon, are facilities that are just going to have to close. They're going to go bankrupt or they're going to sell. And what we've been seeing for the past couple of years were providers across the state taking beds offline, serving fewer people because they couldn't afford to do it, and or selling out to out-of-state providers who weren't particularly good at providing care, who cut to the bottom line, sometimes flipped nursing facilities. And that's going to accelerate as a result of this if we don't find some more assistance.
So one of the questions that's being asked also by Doris Carson Williams, are these statistics that we talked about before by the Department of Health, are they being tracked by race and gender in addition to age and location?
I don't believe so. I don't, at least not in nursing facilities, I don't believe so.
Okay. Okay, so as we start to come out of this lockdown, depending upon what the governor talks about today and the Secretary of Health, people who work in home healthcare settings are likely to see a rapid increase in their own exposure levels to COVID-19. So how do we go about protecting home healthcare aides and the people, that care for them, whether it's in cafeterias, whether it's, LPNs, et cetera? How do we help them?
This is an important question, actually. We all want to go back to our old lives, right? We want to get out to go to a restaurant. We want to start going back to work. And as much as I love seeing my kids every day as I walk out the door from work, getting into the office and doing work in that setting is something that I'd love to return to. But as we reopen, as I said before, we've got to be cautious about it because every contact that a healthcare provider has is a potential opportunity to spread the virus. And so we've got to make sure, whether they're working in a facility-based setting or doing home health care or home care, we've got to make sure, again, PPE is going to be key. We have to make sure that the people they're serving have the PPE that they need to be safe if there are visitors around. But in particular, as these folks are going from home to home, serving the people that live at home and not in a congregate setting, that those workers have the PPE that they need to keep both the older adults safe and themselves safe. And this returns again, I feel like a broken record, to the testing question. If we don't know who has the virus, it makes it much, much harder to keep people safe. And so all of that's going to be important. And then for each one of us, making sure that even as the economy reopens, we still stick to social distancing. We still use masks in public, because even though, as we all know now, we may have it, we may not show any symptoms, but that doesn't mean that we're not spreading it to person, and the next person to have it could be one of those workers.
So how can this be monitored? I mean, as we go through this staging process, how can we make sure that this is being monitored and adhered to for those people who are so vulnerable? If they don't have the equipment, if they don't have what they need, how can we be assured that people who are living with dignity and, they're not seeing their loved ones? So what can we do? Here we are, a whole bunch of people who really care about this and are trying to make sure that people live lives of respect. I feel like we're abandoning them.
Yeah, I wish I had a good answer on how to fix the problems, other than making sure that we were getting the supplies that we all need and the testing that we need to keep people safe. Obviously, there's a ton of great work being done trying to find a vaccine. That will help. But I think remembering that older adults are out there, sometimes living alone in their homes, sometimes living in nursing facilities, and reaching out. I mean, I can say one of the bright spots in this whole crisis has been that older adults who in the past were very resistant to certain forms of technology have started to embrace it. So we're seeing in communal settings the use of FaceTime and Skype, using tablets and laptops to take virtual tours of museums or zoos or other countries, using Alexa more, but using the IoT types of opportunities, and that's really cool to see. I think there have been assumptions over time that older adults don't use technology, and that's patently false. But the adoption rates have gotten so much better in the past couple of months, and that I think provides all kinds of opportunities for the future.
So one of the key containment strategies that we've used to save lives has been this physical separation. So facilities have locked down and prohibited visitors. How long do you think that will continue, given lack of state funds, lack of protective equipment, et cetera? And are there ways, perhaps, in addition to the technology? I'm really glad to hear about that kind of adoption, because that can change lives. I know it does for all of us who are working from home. So, how can we connect, like through technology? Are there other things that our community can do? You mentioned, let's write letters, let your elected officials know there's been zero amount of funds, let everyone know that people who are dying are actually people who are compromised and are elderly. What else can we be doing? We're feeling helpless.
Well, let me start with the visitor restrictions. And so I think it's important to remember that the visitor restrictions are mandated by state and federal government. We certainly encouraged our members to restrict visitors early on, because so little was known, and it certainly has saved lives by doing so. And I think that because of that, until we have more of these resources, we're going to see, whether it's mandated by the government or not, we're going to see these restrictions continue for some time. They may be lessened, and we know how hard that is on families. We know how hard that is on residents. Social isolation in a non-communal setting is one of the greatest dangers to older adults already.
Right.
And so we don't want to see that continue. We want to find ways for engagement. I think technology offers great opportunities in that respect. And one of the things that I've been talking to my members about for some time is we're one of the few sectors that hasn't been significantly disrupted by technology. We've seen drips and drabs here and there, but we haven't seen major technological change come that alters the way that we do business in the way that most other fields have at this point. So I think that's going to come. It's going to come faster now because, as you said, tech folks are problem solvers, and this is a huge problem, and it's going to continue for months and months. And then you compound that with the older adult population in Pennsylvania and nationwide as the boomers continue to age is going to become such a huge part of our market that the opportunity is significant too. In terms of what else we can be doing, I think one of the real shames of this is, although hospital workers have deservedly gotten a great deal of credit and attention for the great work that they've been doing, people who are working with older adults haven't. The attention has largely been about a place like Brighton, where things that are horrible to hear about are happening. But again, the people who are working there and everywhere else are doing everything in their power to keep people safe. They are putting themselves and their families at risk every day that they go into these environments. In some cases, they're self-quarantining, they're sleeping in a hotel or they're sleeping elsewhere, physically staying away from their families. And we need to celebrate them too. And I think as we celebrate the people who work with older adults, that attention that we said is lacking overall for these folks will rise up as well. And that's kind of a simple thing that we can all do.
Right. And the housing issues are real, because one of the things that Brian Kennedy on our team has tried to figure out a way to problem solve is, how do we handle situations where young people are living with their grandparents, and how do we help them with housing issues to isolate seniors, right? I mean, we have hotels that are, not at capacity, but that might not be the right answer. But what are we doing to sort of help in those situations where there are, generations of families that live together?
I think we are starting to see some activity there. Obviously, as you said, the hotels are largely empty. We are seeing some of the national chains starting to provide deals to healthcare workers.
Oh, wow.
Providing at least discounted housing, if not in some cases, a limited amount of free housing as they continue to fight this battle, which is fantastic. That doesn't address the multi-generational family question that you asked, though. And, I'm immunocompromised myself, and I've got 3 kids living in the house. And so it's something that we deal with too. We are going to be much stricter with our children's ability to play with the neighbors and to do what they want to do, because of the risk that it places me at. And I'm a young, healthy-ish guy. So that's something that we have to continue to be very sensitive to. And societal personal responsibility becomes more important now than perhaps it has been in a generation. I think we are asking the citizenry of our country to do more for each other now than we have in a long, long time. The idea of Americans truly sacrificing for one another has been something that I think is kind of foreign for quite some time, because we've had it in many respects relatively easy. This is an opportunity for us to continue to sacrifice for one another.
So we're at the end of our time with you, so I can't, thank you enough. This is a very important topic, and people are asking on our chats how to create a letter writing campaign. We'll work on that on our end from the tech community as well, to see how we can be supportive and to drive this awareness. We have debilitated our economy, and not just here, but around the United States. And we haven't really honed in on what the big issues are. So as someone who, realizes that we're representing such a large community of people who have built Pittsburgh and are now, not being treated and focused with the same kind of respect is very disheartening and in some ways embarrassing. Yeah. So I honestly can't thank you enough. We would like you to raise your voice loud and clear, and we will work on some sort of campaign to at least convey what the issues are, as well as understand what the facts are. And I know this afternoon, our governor is going to come out with the beginning of a staging process. I don't have any clue about what that really means in terms of the nursing home industry and long-term care, but we're very, passionate about keeping people safe, but also building the future for tomorrow. And our economy has been, deeply hurt. And the thought of those aides and people who are working in these facilities getting deeply hurt as well is troubling. It's troubling to me, and it's troubling to the people we represent. So I want to thank you, Adam. We will let people know your address and your website. We'll put that out there. If people want to get engaged, they can reach out to you. and reach out to us as well if you'd like to get engaged in terms of this campaign. So thank you, everyone. We have a busy next 2 weeks. We already have, lined up next week. We have teletracking that's actually in the healthcare business and very, very busy. The president of Robert Morris University. We also have the president of Carnegie Mellon University and the head of the Hospital Association. So we are trying to make sure that everything that we provide to our community is relevant and timely. And Adam, what you gave us today was timely as well.
Spot on
thank
stuff.
you. Thank you, Jonathan, for joining today.
Absolutely.
And thank you, Brian Kennedy, for being, the man behind the scenes, making sure that this work is done. And thank you again for your work, Adam.
Yeah.
Thank you so much for having me, and I would love to partner with you.
Okay,
Absolutely.
thank you.
Let's get something done. We can make something happen here. I'm excited about it.
I love it.
Be safe.